Hello and welcome to Public Affairs Public Access on Houston Media Source TV. I'm Gene Preuss with the League of Women Voters of the Houston area. Thank you for joining us. If you'd like to join in our conversation, our phone number is 713-807-1794. 713-807-1794. You can also find us on social media. On Facebook, it's LWV Houston. And actually, remember those letters, LWV Houston. On Twitter, at LWV Houston, hashtag LWV.Houston. If you know what hashtags are for, I'm still learning. If you're interested in learning more about the League of Women Voters of the Houston area, you can visit our website at lwvhouston.org. My guests this evening will be talking about women's health. And in San Antonio, via Skype, we have Evelyn Delgado. She's the president of Healthy Futures Texas and chair of the Texas Women's Healthcare Coalition. Welcome. With me in the studio, Dr. Heather Goltz, UHD Associate Professor of Social Work, and Dr. Mary Nicholson, UHD Director of University Honors Program. Welcome to the show. Thank you all for being here with us today. Now, we're talking about women's health. I am not a woman, so I wanted to get three people who really know the issues, know what to talk about. I might ask some questions and sound ignorant because I am. But tell us about, first of all, Evelyn Delgado, tell us about what you do.
Okay, so I am the chair of the Texas Women's Healthcare Coalition, and in that role, we have a coalition that's statewide with 84 member organizations. So I work with those organizations to collaborate on how to ensure access to preventive women's health care, including contraception.
Okay. Heather, why don't you tell us a little bit about what you do at UH Downtown?
Oh, thanks, and thanks for having me. So as an associate professor of social work, I primarily teach research methods and data analysis, but I also perform research related to sexual health, particularly among older adults affected by below the belt or pelvic cancers. Cancers of the kidney, the testes, the penis, the bladder, the prostate. And so a lot of my research is related to quality of life, survivorship, and caregiving, actually. So there's a lot there related to women's health.
Okay. And Dr. Nicholson, now in full disclosure, Dr. Nicholson is related to me. We don't have to go into details on that. We don't want to admit it. But she's the director of the UHD Honors Program, but more importantly to the show, she is a historian of medicine. And so tell us a little bit about the research you've done.
Well, my research has been in modern medicine, so I've looked at hospitals, institutional care, infectious diseases, and as well as trauma and accidents. But as far as women go, I've been looking through the hospital situation, and not just with healthcare issues, but also with women in the healthcare professions.
Okay. Well, so I've got three very qualified people here. And so let me just throw out the opening question. And believe me, feel free to ask questions of each other if somebody brings up something you want clarified further. And if you're out there watching right now, listening, feel free to call in at any time. So what are some of the issues that women face? Because I think the perception that men have is that it's all the same. Right? Everybody has the same healthcare issues, but that's not true. So could you please tell us, and we'll start in San Antonio with Evelyn, what are some of the issues that women face that are unique?
Well, women really need access to reproductive health care and really primary care throughout their lives. And so women face challenges when they're uninsured or underinsured or just don't know where to go for services. Women at a younger age are not always educated about how important it is to access the healthcare systems. So those are issues that women will face. And really, women need healthcare throughout their whole lives. From a very young age through their reproductive years, and then we just heard about also in the later years.
So, Dr. Gold, since you're a social worker, I mean, you deal with training students to deal with recognizing some of these issues. So, what do you see?
Well, from a social work standpoint, and to piggyback on what was previously said, you know, when you look across the lifespan of a woman, there are issues of access to care. So that was the insurance piece, the socioeconomic piece, there's the educational piece that was mentioned, but there's the quality care issue as well. Who do we go to for our particular concerns? So when educating our social work students, we train them on what we call the biopsychosocial spiritual model, which is how do we take into account a person's biological, psychological, social, spiritual, etc. Factors in terms of the person in her environment and how that all plays out across the lifespan. So we teach our students to do very specific, deep 360 assessments in order to really get to know our clients and to really help them on much more than a superficial level in terms of access to care, resources, referrals, even clinical therapy.
Mm-hmm.
Is this something new that we're coming upon with, or what about in the past? Have people been more attuned to women's health care than they are today?
Oh, I don't think so. I think in the past, it's one of the issues was, and this is a pervasive issue still, is we have a gendered bias in medicine where when we think of women's health care, we think of this bikini medicine, as it's been called, where it focuses on the breasts and the reproductive areas. And we forget for the heart and then other issues. And so what they've created is a way of, women's health is just one area, but we use men's health with women sprinkled in to address heart issues and matters of blood pressure, things like that. Because women, when they go to the emergency rooms with heart attacks, they're regularly turned away because the symptoms are not the same as men's. Women with high blood pressure issues, it's a similar issue. And so looking historically, if you were to do a search on like women's health and kind of where it starts, it's starting in the 1960s, our bodies ourselves. But women's health goes back so much further. And so there's a lot of agency issues and just the ability to advocate for yourself as a patient on multiple levels.
Mm-hmm. And what we found in Texas, as well as nationally, is that women are dying during pregnancy or the year after when many of those are preventable. Many of those deaths are preventable. And it has to do with what you just said. It's chronic disease type of issues that are unaddressed in a woman before she's ever even pregnant. Her whole preconception period, she may be overweight, have hypertension, diabetes, just heart issues that are not addressed. She gets pregnant, it gets exacerbated, maybe identified. Postpartum in Texas, women who are underinsured or not insured only have 60 days worth of services postpartum. You cannot fix a woman's health in those 60 days, which is why in Texas there is lots of interest by many to extend a women's access to care, to comprehensive care, not just reproductive, but comprehensive care, so that those things can be taken care of before she ever becomes pregnant again and starts that cycle.
So is any of this a socio-economic, cultural issue? I mean, are white Anglo women of different economic statuses any more susceptible than, say, African American women of different economic statuses or Hispanic women of different economic, socio-cultural status? I mean, is it, is it an immigrant problem? Is it what are the various factors that go into these disparities, or is it just a culture? It's like my mom, my mom would take care of us. Oh, you need to go to the doctor, but then she would never go herself, right? Is it a caregiver issue?
Well, I mean, it's all of the above. There's this concept in social work and in medical history and in sexual and reproductive education and health promotion. We talk about intersectionality and how one's race or ethnicity, one's socioeconomic status, class, educational attainment level, all of these things factor into how and when a woman can access care, and also her trajectory and her health outcomes. For instance, it might surprise a lot of people to know that in 2019 United States, African American women are much more likely to die in childbirth than in many non-industrialized or up and coming, but not quite industrialized nations. And that includes the African continent, the South American continent, and other areas of the world. And we're still trying to figure that out. And that's exclusive. I mean, that's inclusive across educational attainment. A Black woman in 2019 America with a PhD, such as myself, is still more likely to die in childbirth than her white counterparts.
What about for Hispanic women?
Hispanic women have a lot more family support. And so Hispanic women are more fertile. They have more children over time, but they do have a lot of family support that helps them through some of their health issues. But Hispanic women also encounter some unique issues, like you'll find more domestic violence or homicide in Hispanic women, which is sad to say, but that's what the data shows when we study maternal mortality. But the good thing is there is that supportive family help whenever they are pregnant or postpartum.
So is this, I mean, I'm kind of surprised by the statistics here, and it's a little troubling. So what have we done throughout history to kind of address these issues? Are we broadening the scope of women's health in the general public's eyes? What about laws that we're passing?
Well, I think that from a historical perspective, things have gotten better in some senses. As women entered as more women entered the medical profession as not nurses, but as gynecologists, obstetricians, and physicians, and actually as part of the medical faculties in the medical schools, that did improve things. But at the same time, when we're looking at where we are now and where we could be, there are many of the same issues. If you look about how we talk about menstruation, it's stigmatized. I mean, it's not there are these arguments in Congress right now about, giving tampons in prisons as a luxury. And it's something, these aren't things that are luxuries, but it's stuff that's not talked about. And so it's really, I think in terms of the laws, and then we go into reproductive health, women aren't fully in the picture. I mean, there was a photograph a couple of years ago of a conference on women's health, and everyone at the table was male. And that's really kind of a sad commentary on where we are in terms of where we could be. But I think with women entering the medical profession more, and we see more women gynecologists, obstetricians, that's beneficial. But at the same time, we don't see enough people of color.
Yeah, but outside of obstetrics and gynecology, the female trainee presence in other specialties is very different. There are solid disparities in terms of, for instance, the medical discipline most closely allied with my research, urology. There are many fewer female urologists than males. And those female urologists tend to, for a number of reasons, family pressures, childbearing years, etc., tend to not necessarily work the same number of hours in urology as their male counterparts. So they may work maybe more than part-time, but not the 80, 90, 100 hours that the male counterparts may be working. And one of the downstream effects of that is, take bladder cancer, for instance, which is one of the cancers I study more closely. Women, in particular, this is primarily a male disease, but when women are diagnosed, they're typically diagnosed much later.
Right.
Much later, because the primary symptoms are often misdiagnosed as menopause, as menstruation, as UTIs or yeast infections, anything but bladder, even though if a male were to go to the urologist and with blood in the urine, they would absolutely be screened right away for bladder cancer.
So it's almost like we don't think women can get the same things that men can have, or this is like with heart attacks. I remember when I found out that the symptoms for women were different than men. So I think about are there women out there who tell their male partner, I'm having these symptoms, and he might just blow it off and say, you don't need to go to the doctor, and they don't.
It affects brain tumors as well. That women with brain tumors are oftentimes diagnosed later because of women have it's just a headache, and that's led to the brain tumors being diagnosed much later than they would be in a man.
Yeah, I mean, even take, for instance, incontinence in later life. We tend to think of incontinence as almost destiny for an older woman, particularly after menopause, when that's actually not quite true. There are many things a woman can do to prevent incontinence in later life. Incontinence in later life can actually be a sign that there's a problem. It's not a destiny or a fate. It can signal a true problem.
And I think some of that education needs to start at a very young age. At Healthy Futures of Texas, which is my other role, my primary role, actually, as president of that organization, we focus on teen pregnancy prevention. And through that, we do a lot of health education to young people. And what we find is that for sure, in the high school grades, the young people just don't have a lot of knowledge about their health and their reproductive health and just how to take care of themselves. But we're also do services in community colleges. And when we do sexual health education with youth that are already 18, 19-year-old, we see that they too don't know a lot about their health, about their body. A lot of them don't even know their reproductive anatomy. And so if you're trying to plan your life to be successful, to finish education and just, kind of have a life plan, and if you're going to consider, for example, contraceptives as a way to plan your life, you really need to know the basics about your health and your body. And so what we find a lot is that we are being the educators for 18, 19-year-olds because they haven't gotten that in earlier years.
So it's not that you're just educating students on how to take care of others whenever they get into a profession, but you're also teaching them how to take care of themselves and what to look for in themselves. I think that's an important thing to keep in mind. Now, unfortunately, I think there's a lot to talk about here, and we only have a limited amount of time, so I think we're just scratching the surface. But let me shift gears here, and I'm going to ask all three of you, and I know some of you have very strong ideas about this. But so this is the League of Women Voters show, and so going to the polls, what is it that voters, men and women, need to know whenever they're seeing candidates? I mean, because I don't think this is talked about very much in our political discourse. So what is it that people need to be aware of? What are the questions we need to be asking candidates? Let's start with Evelyn.
I think the question is around healthcare. Healthcare is the foundation to people's futures, to whether they're able to be ready for work, to raise children, to have just a good life. And so I think access to preventive healthcare for women and men, but I'm primarily our services focus quite a lot on women. I think that's something that we need to continue to bring up. There seems to be a lot of more interest this legislative session than there has been in prior sessions for Texas in terms of the positive things that can be done. So I would say continue that conversation. Support preventive health care for women.
So a lot of the, I think a lot of the discourse, there is some discourse, and it's all on Obamacare, just as a big umbrella term. But so what is it that you think voters need to be aware of? What are the questions that people should be asking?
Oh my gosh, so many. I could take all night. I think it's really important for voters to really look at the party platform, not just look at the particular candidate's record or what they say they will do in office, but look at their party's platform and look at how the platform outlines access to health care. Is health care a right in the eyes of that platform, or is it, some type of, reward for some imagined, climbing the tree, pulling yourself up by your bootstraps? If you don't have shoelaces, you're not pulling yourself up by anything. And so really getting and becoming aware of the platform, and then asking the candidates the tough questions about how they plan to put that platform into practice. If you don't agree with the platform, it doesn't matter how well a candidate represents themselves in terms of their own agenda, they go by the party platform.
Mary?
Well, primarily it's like we hear a lot of commentary on medicine, on science, that is, my opinion is as good as your expertise. Medicine is not something that is, this is how I think the body works. And so when we hear candidates say things that are, incredibly wrong sounding, or if they're saying things that contradict medicine, such as issues with vaccinations and such as this, I think that those are harmful ideas, and we need to call those out, because a strong public health is a strong community health, and it plays into how us as individuals are going to be able to succeed and contribute along those lines. I also, I think with insurance issues and things, in terms of asking what is the exact plan? If you want to, with Obamacare, what are you going to replace it with? So those kinds of questions, and being persistent, and asking where do women fit in as well.
Okay, in 1 minute, what is something that we need to know right now?
Right now.
That is a tough question.
That is a tough question.
Heather, we'll start with you.
Okay, I like what Mary said about public health being community health, being individual health. There is no individual or family health without public health.
I think with women, if it's an issue and taking care of the child and then skipping a medical exam for yourself, realize that women, you can't continue to be a care provider if you're not capable of doing it.
Self-care.
Yeah, self-care is important.
Yeah, taking care of yourself, I think, is an important issue. So, Evelyn, in San Antonio, so you're looking at, you said 81 organizations?
84.
84 organizations. That's a broad spectrum. What?
Yes.
So can you condense that down? So what is it that people need to know right now?
I think people need to know that women tend to be the lead for their families of health. And so the woman must be healthy herself and be able to plan her life and what she can do herself so that she can then support the rest of her family's health future. You'll read that over and over again, that a woman's health is key to the health of the family.
So thank you very much. Let me ask you a question. How do we get in touch with one of the organizations that you represent, or even your organization?
Healthy Futures of Texas is in San Antonio, and we focus on teen and unplanned pregnancy. So you can reach us at hf-tx.org. And then the Texas Women's Health Coalition is part of Healthy Futures, but you can also reach them through Healthy Futures.
Okay.
It's a Texas Women's Healthcare Coalition.
Okay. All right. Well, thank you very much, and I want to thank you for being here. Heather Goltz, Professor of Social Work, Mary Nicholson, who is the director of the UHD Honors Program, and actually we've had some of the honor students on before.
Right.
And they do a great job. I'm sure we'll have them on again. I think, as I said earlier, this is a broad issue. We've scratched the surface. I learned a lot just listening to the three of you answer those questions I posed, and I really appreciate that. And I think we need to come back at some point and do this again soon. So don't whenever you see that phone ring, that'll probably be me.
I'll pick up for you.
Thank you very much. In our next segment, we're going to talk about something very interesting and very important, I should say, prejudice, bigotry, and hate crimes. Just a couple of weeks ago in New Zealand, half a world away, there was a mosque shooting. And this is just one of many examples. And so we'll be talking about prejudice, bigotry, and hate crimes coming up on our next segment. Once again, if you'd like to join us in our conversation, and I'll repeat this again later on, our phone number is 713-807-1794. I'm Gene Preuss with the League of Women Voters. Thank all of you for joining us, and we'll be back in just a few minutes. Hi, I'm Gene Preuss with the League of Women Voters. Once again, our phone number, if you'd like to call in and join this conversation, is 713-807-1794. We have, I am having two of the guests stay with us and help us with this conversation. On via Skype, the magic of the internet, we have Dr. Tom Ford, who is at Western Carolina University. Dr. Ford, welcome to the show.
Thank you, Gene. Good to see you, and thank you for inviting me.
Yeah, I've got to say, this is another full disclosure. I have known Tom Ford since we were in high school, right? We
Oh, wow.
worked
Yeah.
at a fast food restaurant together. We
Yes, we
won't mention
did.
any names, but it's a very popular fast food restaurant among our students. And Tom,
Yeah.
after high school, Tom went off to college. And tell us a little. Well, go, you tell the story.
Well, after high school, I went to Texas Christian University, and then I majored in psychology there, and then pursued my doctoral degree in social psychology at University of Maryland. And since then, I've moved around a little bit, and here I've landed in the western part of North Carolina at Western Carolina University.
And you're kind of, so people know where that is, that's between Charlottesville, North Carolina, Atlanta, and Knoxville, right? You're kind of in the middle of that triangle?
I would say, 50 miles west of Asheville.
Asheville, okay.
Oh,
Yeah.
nice.
Okay.
Asheville would be the best reference point, and we are probably about maybe 100 miles from Knoxville, Tennessee.
Okay. So you're in the mountains.
That's right, foothills of the Smoky Mountains.
Okay. Beautiful, I'm sure.
Oh, it's beautiful.
Oh, it is, absolutely.
So
Yeah.
I don't know if you got to see our other guests earlier, Tom. So Mary Nicholson, you have met her before. She directs our UHD Honors program.
Yeah.
And Heather Goltz is one of our professors of social work. And so she also brings some knowledge to the topic. And actually, I've got to admit, Tom's a psychologist, and so I was talking to him earlier about this, and this is a topic that he has kind of clued me into many years ago. The idea of how we deal with prejudice. And Tom has been researching this from a kind of a unique perspective for a good 20, 30 years maybe, Tom? Are we that old?
Well, how old are we, Gene? Yeah.
So, and what he looks at is humor. And so I'm going to give you the dumbed down version because Tom can talk about it in psychological jargon much more so than I can, and I kind of follow along. But this idea that as we use humor, it desensitizes us to people. Is that correct? Is that accurate?
Yeah, I would agree with that. Yeah,
okay.
Absolutely.
So why don't you tell us?
Yeah, I would just say, just to add to that, humor, just by definition, it reduces or it trivializes, it minimizes its target. It reduces it to something that is less. So it makes less of something, and it allows us to think about its target in a very playful way, to trivialize it. And so when you say desensitizes, I would just add, well, it trivializes its target, and perhaps this desensitization is really just it makes us think less critically and more playfully about what I get into, which is disparagement of social groups.
So recently, and what kind of made me think about this is I was in Atlanta for a workshop a couple of weeks ago, and the news came on about a shooting at a mosque in New Zealand. And if you look at, we think, well, that's half a world away, what does that have to do with us? But if you look at incidents like this, the Southern Poverty Law Center has reported that we have seen an uptick in racial and hate crimes and attacks on people. And I do some work on Confederate monuments. While I was in Atlanta, I was at a Confederate monument taking photographs, and I noticed on the sidewalk in front of me, somebody had scribbled the word Jew. And I just thought, it just happened on this, and, we've had people of all faiths attacked. We have, different than the attacker, we have people who attack people based upon their race. And in fact, some of that is even in part of the national discourse. I see people on social media who say, well, I know about this group or that group based upon my research, And I think that research is just looking at other people's memes on Facebook. So how are we affected by that when this is such a national topic? I think this is a big issue. How do we address these big issues? Tom, we'll start with you.
Well, very good questions. But as you were talking, I was thinking that those events that you mentioned, I don't believe reflect mainstream people. I don't even think they reflect mainstream prejudice holders. I think most of the time now, people go around life, people who have prejudice against social groups typically go around life suppressing that prejudice, keeping it under wraps, maybe because it conflicts with egalitarian values that they also hold, or maybe because it violates prevailing social norms. And if they express those prejudices, they run the risk of social sanctions. And so I would say mainstream people who would be described as prejudiced would not be likely to act out in the ways that you described, but would rather only act or express their prejudices when something in the environment signals to them that it's okay to do so, that it's okay to express prejudices in this particular context because you're safe. You're safe to do so. If you do express your prejudice, you won't be criticized by others. You won't be sanctioned socially. And so that I think is my first thought, that these horrible events that we're talking about in Christ Church and others, in my opinion, don't reflect mainstream even people that have some prejudice, some animosity towards social groups, but rather seem to be rather extremist. Yeah.
So let me ask you a question, Heather, as a social worker. Don't we, as social animals, don't we all have some sort of prejudice? I mean, we may not call it that. We call it, we have our certain teams. You're from Louisiana, I'm from Texas. You went to this high school, I went to this high school. We look at it in different ways, but don't we all have some of this in our nature a little bit?
Well, man's search for meaning, right? We are a creature that throughout the history of humankind categorizes things, right? If we see something and it doesn't jive with our previous experience, we feel the need to put it in a box, to name it, and then in doing so establish, is it a threat or not, right? We all have different identities, different intersections. For instance, I'm an educated Black female from a very poor Southern Louisiana family. All of those different pieces of my identity have more or less privilege or power associated with them. And each of those has social or cultural lenses associated with them. So I loved what was said about, how we may have this internal conflict sometimes. And that's precisely what can happen, where we have this internal conflict and in a situation where maybe we feel we have more or less power, we have more or less permission to say what may be, knocking around in our mind, and then how we then talk about our bias, or more so than bias, a prejudice we may have. Mm-hmm. And so, yes, the answer is yes, we all have them. It just is a matter of what's the context, what's the subject matter, and with what identity lens are we speaking.
So you deal with a very diverse group of college students at the University of Houston downtown, and a very diverse section of honor students. How do these students, who are, what we would consider, really good, above average, driven, motivated students, how do they deal? Because I know that some of them have had these issues. How does these students deal with it today?
Well, I also, and I think more broadly, my experience as an educator, one of the things that we look for in teaching students, because I taught public school for 10 years as well, and you want to see when students face challenges or they're in a situation where somebody has said something that is seen as inappropriate, you make a comment when they feel empowered enough to speak out and say that was wrong, we don't use that word, we don't say that. That's an important kind of signal as to where they are in terms of maturity and capability to address these sorts of situations. I know with the honors students I currently work with, many of them are, by virtue of their diversity, what they've done is they've gone and they've learned more about the other cultures of the other students. And so there's this, and this is what they've said, with traveling and getting to know people that aren't like you, that it leads to more acceptance and also kind of this protectionism. I remember there was an incident a couple years ago where they were protesting something at the mosque, the Dawa Center that's down from the university, and the outrage of the students that, who would protest these people's right to go to their prayer on Fridays. And so the students, many of whom were not Muslim, went down the street and protested the protesters. Mm-hmm. And so that activism, I think, is, especially amongst young people, it's really, it's great to see. Mm-hmm. But it's, people, they're aware of the problems, and it's not just that they're living in a bubble. I mean, it's, I think a lot of them are very much concerned about what's going on in the world.
Tom, I think you brought up a very interesting point, and I think you're 100% accurate, but that many people have prejudices. That's not unusual. The problem is acting out on them, and it seems that the media, just by its very nature, here's an incident, so they're going to report it, and so maybe that's exacerbated in our mind that we think a lot of people are doing it, and certainly you may have more incidents, but that it's an extreme position. How do most people deal with that, and where is the line between what we might call our prejudices that we have and that we might keep in ourselves to when they start coming out and forming what we would call bigotry, where we're acting upon those prejudices?
Mm. Yeah, I guess I would go back to that, the comment I think I made, that the people that hold prejudices, they keep them under wraps unless something provides a cue that expression of prejudice is okay, or will allow one to escape criticism. And so to the extent that the media creates such a cue, well, then I think it might contribute, it might foster the expression of existing prejudice. In my work, for instance, we find that humor, disparagement humor, racist jokes, sexist jokes, anti-Islamic jokes, they can provide a cue to people that signals that it's okay to trivialize the prejudice against the targeted groups and to think lightly of it, to let down the critical sensitivities and relax the usual critical social norms about thinking about discrimination against such groups. And so that in the context of disparagement humor that might occur on media outlets or otherwise, I think people can gather a cue from that at least in this context, it's okay. It's okay to express prejudice without fears of reprisal. For instance, in some of my empirical studies, we bring men to the laboratory and we have them sit in groups and we expose them to TV shows that include clips of sexist humor. And when they're exposed to these clips of sexist humor, then we give them opportunities to discriminate against women and other groups. And what we find is that men who tend to have sexist attitudes to begin with are affected by the humorous portrayals, sexist portrayals of women on TV. And so it actually increases their willingness to engage in subtle forms of discrimination against women. And again, I'm talking about men who have got prejudice to begin with. And so what these media images that portray women in very stereotypical and demeaning ways, what it does is it provides what we might call a releaser of prejudice. It doesn't initiate prejudice, doesn't create prejudice where it didn't already exist, but it is a releaser of prejudice. It gives people an okay to express the prejudices that they have without fears of reprisals from others.
So it's kind of like the whole nurture versus nature issue in some sense, is that if you're around it more, and if you allow yourself to be influenced by it more, you're more willing to let those things flow, I guess.
Well, and okay, and then to add to what you just said, then, well, what if we include a person in that group that objects to the humor, that challenges the humor, that doesn't tacitly accept the humor in its underlying message, that it's okay to trivialize instances of sexism? But when that happens, then nobody in the group seems to be affected by the humor. So nobody then switches to this non-serious, playful mindset for thinking about the underlying discrimination against women. In a sense, nobody actually then trivializes the sexist humor if somebody in the group challenges or opposes it.
Really, that's very interesting. That so one person can make a difference.
Yeah.
Changes the way the people in the entire social setting interpret the humor.
They lose their safe space.
Yeah.
Because there's somebody that reinforces the social norms that they think that they've been able to drop.
Tom,
the broader social norms that they think they're able to drop, right?
You sent me an article, and in that article there was a picture, a three-paned. I took the liberty of bringing that up and asked our producer Mark to show us this. And if you could kind of walk us through this. This is from a book. And I've got the page number there and the author is up there. Can you kind of walk us through this a little bit?
Yeah, you can think about prejudice in terms of three positions that social groups might occupy in society. And these three positions are represented as these adjacent windows, according to this model. In the first or leftmost window, what I refer to as the justified prejudice window, behind that window, you would find groups that are defined as deviant. These are groups like terrorists, racists, kids who steal lunch money, people who would be considered bad, harmful, morally inferior. And the thing about those groups is that negative attitudes towards those groups is condoned. In fact, you really should have a negative attitude toward those groups if you are yourself a good person. Then move all the way over to the rightmost window. That's called, what I refer to that as the unjustified prejudice window. And behind that window, there are groups that are consensually defined as good or righteous. Groups like, as you can see here, farmers, housewives, firefighters, history professors, and public TV hosts. Those are groups that are behind that unjustified prejudice window. And again, socially defined as righteous. And what that means then is that prejudice towards those groups would be seen as wrong and unjustified and just flat out weird and strange. Negative attitudes towards those groups would actually violate collective societal values or standards of decency. Now, what's interesting, though, and I should mention that if you look at those two windows on the ends, the justified prejudice window and the unjustified prejudice window, the norms of justified or unjustified prejudice are consensual, and that means they're very stable. They're agreed upon in society, and so they're not subject to situational influence so much. Now, what's interesting is that middle window. The middle window, I refer to that middle window as the shifting acceptability window or the normative ambiguity window. Behind this window, you find groups that are not considered deviant, but they're not considered righteous either. Instead, what makes them unique is they're socially defined as disadvantaged. And today, such groups in our society might include racial minorities, sexual minorities, women, religious minorities. Now, there's some point in history, where were those groups? If you think about all of those minorities, they were at one point in our history, pretty recent history, in that justified prejudice group window, that far left window. But through broad social movements, those justified prejudice norms began to give way to more norms of increasing acceptance of those groups. You know, think about the great gay rights movement of the 1970s, for instance, and that resulted in a broad normative shift in the way that we think about, the way that Americans think about and treat gay people. So that movement, I'm arguing, acted like a big hand that pushed gay people as a group from that justified prejudice region toward the unjustified window. And as a result, gay people began to be redefined, not as deviant groups against whom prejudice is justified and acceptable, but rather as disadvantaged groups who have been denied unfairly civil rights. So prejudice against those groups in that middle window is considered wrong. So there's an emerging norm as groups move into that window. There's an emerging norm that prejudice against those groups is wrong. It's not justified. The problem is it's not completely consensual yet when groups are in that middle region. That's why I call that region a region of shifting acceptability. And because it represents a region where norms are, and broad societal norms are shifting and changing, shifting from completely acceptable to be prejudiced against them to being completely unacceptable.
You know, it's yeah. I mean, not to cut you off there, but you know, what you're saying really reminds me of when I was growing up, and like I say, Tom and I went to school together. There were people who we knew were gay, and you know, it wasn't easy. It wasn't by any stretch of the imagination, but you know, some of them were friends and whatnot. Today, I'm heartened to see that those people don't have to face some of the same problems they would have had to face 20, 30, 40 years ago. Now, that's not to say that everything's hunky-dory, but there's still prejudices. But I do see that shift. I see some people who, you know, several years ago might have said something and today don't. At this point, let me introduce, we have a new guest that just came in, and he's also with the League of Women Voters. He is Philip Yates, Vice President for Study and Advocacy, and welcome to the show. And I also understand, if I'm not correct, let me know that you're a new father.
I am. Thank you for having me. Thank you. Yeah, I have a 23-month-old and I have a newborn, so it's pretty busy at my house. But thank you for that.
Well, thank you for coming on, and I'm going to bring you in here in just a few minutes. And so, Tom, what I want to do we've got a few minutes left. What I want to do is we've been talking kind of academically about prejudice and racial issues and bigotry and how that may translate into hate crimes. So since we have our policy expert here for the League of Women Voters, I want to break it down to a more practical level. And so I want to ask two things. Some of them I asked in the first segment. What can we do about this today? And as we go to the polls, what do we need to know to ask candidates? Because one thing that I'm very concerned about here is I think we tend to focus that this is a conservative versus liberal issue, and it really isn't or shouldn't be, right? You can be conservative and be very open-minded, right? It's not, you don't have to be a racist to be a conservative. By the same token, and this, you know, I'm a big fan of James Baldwin and he always talked about how prejudicial liberals were. So that kind of flips the table there a little bit. We tend, I think young people today tend to see this as a conservative versus liberal issue, and it really isn't. And in many cases, we see people who are wearing MAGA hats and not, who are attacked at restaurants as well because they're associated with this, even though they may not have those things. So what can we do today to address some of these issues? What kind of attitudes do we need to adopt? What do we need to say? I'm really struck by what Tom just said, is that one person in the room can make a lot of difference. So Tom, what do you think? We'll start with you.
Well, that's a very big question to begin with. And actually, in thinking about that, my first response is that I think people need to, as you mentioned, sort of drop the partisan lenses, and instead of viewing people as belonging to one team or another, you're on the Democratic team, I'm on the Republican team, therefore we're going to be antagonistic. I think we have to eliminate that. I think that we have to talk about these issues as we are here, and begin understanding some of the foundations, psychological, social, psychological, and sociological foundations for inequality. And we already talked about this, the psychological foundation of social categorization, and then we can add to that, sociological layers of social structural inequalities, and begin to understand how those those variables work together to create antagonism or prejudice more generally, and problems like racism and sexism, and then begin to work at them at their foundation levels.
Okay, Heather.
Oh, wow. To piggyback, I really, really think it goes back to what I said in the earlier segment about the various identities that are within each individual person, where some identities have power or privilege and other aspects of their various identities don't. And so really to attack the heart of, those isms, and to shift that middle window that he was talking about more towards the right, where very broadly there's this acceptability. We need to really create a climate where we challenge each other. Mm-hmm. When we see us behaving in ways that limit people's opportunities, that diminish people, mm-hmm. that other them, and that make them feel inferior.
Mary, you've got about 45 seconds.
Ditto.
Okay. Philip, I'm glad you're here. I want to ask you a couple of questions. What do we need to ask our politicians?
That's okay. So I think when you ask, what do you need to ask your politicians? I think before you do that, I think as policy and advocacy leaders, we have to go talk to the community members first. And I think a lot of times we go to these leaders and we think they have the answers. We think they have all the right answers. And I don't think that's always the case. I think sometimes we have to go back to the root problem and define the problem. So when you talk about the isms, I look at even the box that Tom just had up there, and it's like, I didn't see alcoholism and people who are drug addicts. And I think they should be in that box because we stereotype them. And as an attorney, I see that we make those laws as if we know what they went through. Yeah. We understand, what the conditions are and what it takes to actually heal them. We automatically just penalize them and we make them check this box, and they're pretty much labeled for the rest of their life until they get in somebody's good graces. And so I say all that to say that I think before you get to the politicians, do a better job of defining what the problem actually is. Understand some of those cultural sensitivities and break down some of those barriers. I think for like the African American community, I think it's not about Republican or Democrat anymore. It really is about understanding the systemic issues that community has went through. So, when you have bills that people say, like, let's do reparations, like, That's no different than, in my opinion, and I haven't read through the full bill. I like the approach, but I also think sometimes it's like affirmative action. It's like you're just injecting steroids into it and saying, let's just solve this, let's have this broad umbrella and it's going to fix everybody, instead of what's the root problem and how do we solve that from a policy and advocacy standpoint. I think it starts with the community, then take that to the politician.
Philip Yates, that's a great point. Thank you for making that. Tom Ford at Western Carolina University, Heather Goltz, Mary Nicholson at University of Houston Downtown. I'm Gene Preuss for the League of Women Voters of the Houston area. Stay tuned. We're going to talk about Pasadena candidates coming up the next time you hear from us. So stay tuned. Tune into the League of Women Voters for more information. Thank you very much for being here.